Good morning and thank you for joining us. My name is Tina Thibault and I will be your moderator for today's briefing. Joining us today, the Honourable Iain Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good morning, everyone. Before we get into the briefing, I just want to reflect for a moment on the two tragedies we had over the last few days. And so my thoughts are with the families, friends, and community of the crew members of the FV Taiwak of the LC Puktuk First Nation, which capsized off the coast of Shetty Camp. One crew member died, another is presumed dead, and 3 others were injured. As well, 2 men who were fishing on a lake in Digby County died after their boat overturned. Again, my condolences to the loved ones. Let me also extend my thanks and gratitude to all those involved in the search and rescue missions. Now, today is Tartan Day. You may have noticed that both Dr. Strang and I are certainly not clashing when it comes to our ties and pride in our roots of our province. And so I'm wearing my Nova Scotia tartan with delight today. This one's actually made by Veronica McIsaac. Many who wear kilts probably know the McIsaac kilt makers in St. Peter's, so I have many of these tartan ties, and this one's for Nova Scotia. For our case numbers, we're announcing 6 new cases of COVID-19. 5 are in the central zone, 1 related to travel, and 3 are close contacts of previously reported cases. 1 under investigation. There is 1 case in the eastern zone, and it is a close contact of a previously reported case. From Thursday through the weekend, we vaccinated nearly 10,000 Nova Scotians. Clinics were running all weekend with the exception of Easter Sunday. Thank you to everyone who was working or came out to get vaccinated. We are not slowing down. In fact, this week we'll have 47 pharmacies operating with the Pfizer and Moderna vaccine. And I'm pleased to say all appointments are booked. So this means that this week we will be vaccinating more than 40,000 Nova Scotians. As you can see, we're really ramping up as our supply becomes more and more. This week also marks the start of the first African Nova Scotian Community Clinic on Wednesday in Upper Hammonds Plains at the Emmanuel Baptist Church. I'm told there is more interest than we expected, and we're able to accommodate everyone over the age of 55. As you can see, our vaccine rollout is on track, and more appointments are being added for next week. If you are over the age of 70, please call or go online to get your appointment. And bookings also open today for our next shipment of AstraZeneca. 54 pharmacies and doctors' offices are offering this vaccine to Nova Scotians between the ages of 55 and 64. Between the 70-plus clinics and the AstraZeneca clinics, we now have over 140 clinics operating. And let me end on some more good news. Given our continuing progress in fighting the pandemic, I'm announcing that we're lifting more restrictions, starting with the Newfoundland and Labrador border. You will no longer have to self-isolate for those 14 days in Nova Scotia. On the recommendation of Dr. Strang, we're confident that the low case numbers make it possible for us to remove this measure. We're also watching New Brunswick very closely. And if Dr. Strang decides is necessary, we will shut that border down. But as of now, non-essential travel to the Edmundston area is not recommended. However, I'm pleased to announce that malls, retail businesses, and fitness facilities can now return to 100% capacity with physical distancing, and that's as of 8 a.m. tomorrow. Also, sports games, training, and arts and culture rehearsals and performances can have 75 people. While physical distancing and masks are not required for the activities, they are recommended when possible. Spectators can continue to be allowed at these events except for at our schools. This is great news for our service and retail sector, also great news for our sports teams and arts here in the province. Thanks to your hard work, we're able to keep our cases low and we're able to open up just a bit more. But again, we'll monitor this very closely and be nimble as we have been, and we will shut down when we need to. Thanks, and I'll turn it over to Dr. Strang.
Thank you, Premier, and good morning, everybody. And I, too, would like to give my condolences to the families associated with the tragic fishing events. And my Nova Scotia tartan tie, I'd like to say thank you to Sherry from Maritime Tartan Company, who provided this for me back last spring. I'm sure the confirmation of the 4 new variant cases today and the uptick of cases over the long weekend isn't news that anyone wants to hear, especially when we see what's happening across the country. The COVID-19 variants are spreading rapidly with dire consequences in many provinces. The good news, however, in Nova Scotia is that almost all of the cases we are seeing are travel-related or connected to a travel-related case. Some people have to travel for their jobs, whether they are rotational workers or temporary foreign workers or truck drivers moving essential goods. Quarantine, testing, and other public health protocols for these groups and for regular travelers who choose to travel have helped minimize the possibility of community spread of COVID-19. And when we have had COVID-19 transmitted from travelers into the community, the protocols and restrictions we have in place for all Nova Scotians are preventing widespread. And I thank all Nova Scotians for continuing to follow those protocols and adhering to the restrictions. We need those in place for the weeks ahead. And now I'd like to kind of mention some things around our vaccine program. We have been cautious in our decisions with respect to our vaccine program in an effort to provide certainty to Nova Scotians. The low level of COVID-19 in our province has allowed us to make choices to protect Nova Scotians and our vaccine program from the uncertainty of a still unstable vaccine supply. We only release appointments once supply has been confirmed, and we work within a 2-week schedule between confirmation of supply and actual use of the vaccine due to the need for repackaging and distribution to ensure we never have to cancel appointments if delivery dates change, like they did with the Moderna shipments twice in the last few weeks. Just today, another province had to cancel thousands of appointments because of a shipment delay. We do not want to find ourselves in that position. It's important that Nova Scotians have certainty and that they can count on our vaccine program. And that's also why you get your appointment for your second dose when you book your first dose appointment. The second one is automatically booked 105 days after your first appointment at the same time and location. At the end of April, anyone who has booked an appointment for a first dose will get an email confirming the details of their second dose appointment. This weekend, I read a news story about someone in another province who called over 50 pharmacies to try to make an appointment. Nova Scotians can use our central booking site and a central toll-free line to book appointments, regardless of where they live or where they want to get their vaccine. And yes, there have been a few technical glitches and frustration points, but as those are identified, we work quickly to fix them. And in fact, later this month, there will be a postal code lookup feature added to the online booking site. So users will be able to enter a postal code and see where there are appointments in that local area and for which type of vaccine. We have built a reliable vaccine program, and we are working hard to make sure that Nova Scotians have not only a safe experience, but a positive one as well. And as I've said before, we have gotten good, and now we are getting faster week by week as supply increases. The final thing I want to mention is about distribution of appointments across the province. I've been asked many times why there aren't as many appointments in one place as another. This is because we are distributing a limited amount of vaccine and appointments across the province equitably based on census data and population estimates. We don't want one part of the province to get substantially ahead of another part of the province in terms of access to vaccine and percentage of population immunized. And as we add appointments and they get booked up, that happens faster in some areas than others. So there will be this natural fluctuation up and down based on supply and booking of appointments between one part of the province or another. But I ask people for your continued patience. You will get an opportunity. It may not be immediate, but you will get an opportunity in a very short period of time as we get more vaccine and we distribute the vaccine in your local community. We're going to handle the vaccine rollout the same way that we've handled our response to this pandemic all along, as a province together. There will be access closer to home for everyone as supply continues to increase. So in closing, I'd like to ask Nova Scotians to do 2 things. The first is to keep following the public health protocols. Be mindful of what's happening in other provinces and know that the situation in Nova Scotia could change quickly if we let our guard down. And my second request is to ask that you book an appointment to get a vaccine when it's your turn. And if you've tried to book and there are no available appointments in your area, please be patient. We will continue to add appointments as we get more vaccine. Tina.
Thank you. Just a reminder, we'll take one question and one follow-up in the allotted time that we have for today's briefing. We have a hard stop at 12:30, so I will take as many questions as I can in that time frame. I'll start with Elizabeth McSheffrey from Global. Go ahead, Elizabeth.
Thanks very much. Just a quick technical clarification. Does that mean Nova Scotians can travel to Newfoundland without isolating?
No, not until April 19th is the
Okay.
plan right now, still with the bubble. It's just when they come in here. Yeah.
Okay. So Dr. Strang, I'd like to ask about Nova Scotians who get their first dose of the COVID vaccine in other provinces. How can they ensure that they get the same vaccine in Nova Scotia when booking their second dose? How exactly does that work?
So we're working through the details of how we would do that. Right now we're focused very much on the first dose of vaccine. We're starting to look at how we deal with second dose. As I said, appointments. Nova Scotians get an email starting in April. We have to look at that and how we accommodate that as well, step by step. Let me just clarify for the Newfoundland, if I can go back, that comes into effect at 8 a.m. tomorrow morning.
Okay. And my second question pertains to rotational workers specifically. I know you had mentioned last week that right now you're looking at vaccinated rotational workers maintaining their modified form of self-isolation. So they would be tested negatively, potentially have 3 negative COVID tests and be fully vaccinated and still have to quarantine. I just wonder if you're considering any alternatives?
Yeah, we're looking at that actively. I've asked my team this morning to look at what's happening in New Brunswick, Newfoundland, PEI, look at where we're at. We're expecting to have some more information coming this week around the ability of vaccination to limit asymptomatic transmission. But we also have to be very cognizant about what's happening. I was on national calls on the weekend. Extreme concerns in other provinces where our rotational workers are working around the explosive nature of variant strains. So yes, we're going to look at it, but we also have to be extremely careful. We're not going to take unnecessary risks with bringing these variant strains into our province.
Go ahead, Shana, with your question.
Dr. Strang, you pointed out that most, if not all, of our recent cases have been connected to travel, but we are still seeing some public exposure notices. Given that people who've traveled and their close household contacts should be self-isolating, how is it possible that we're seeing exposure notices?
So not all travelers are, we have exempt travelers. We have truck drivers. We have other types of exempted, travelers who, in specific occupations, military, other folks. So there is the vast majority have to quarantine, but not everybody. And so sometimes, and the most common one, maybe a truck driver who they're asymptomatic. They don't know, and then they go get one of the routine tests, and because they're asymptomatic, they were somewhere as they're allowed to do, and then we have a notification on that. The other situation can be from a close contact. Once we identify close contacts aren't necessarily have to quarantine until they're identified as a close contact. So they may have been somewhere in the 48 hours before they were identified as a close contact. And then they're put under isolation. So there are circumstances where people are able to and still justifiably and be out in the community. And once we get information, we say you could have been infectious at that time. So just because there's a community notification doesn't mean that somebody has done something wrong.
Does that suggest to you then that if possibly some of the exposures might be coming from people who rightfully are out in the community, should they or their households be bumped up for vaccination just to protect others from possible variant cases coming from other provinces?
So we don't, vaccine isn't a tool to deal with people who are cases and contacts. Vaccine is a longer term strategy, and we're focused on using that to get as we said many times, based on age. It doesn't prevent your somebody who's been exposed. It doesn't modify their. We don't give them vaccine. It doesn't modify their disease or their risk of developing disease. It's a longer-term strategy. So it's a different approach that we take. People quarantining them, we identify them, we quarantine, we test them as their cases and contacts.
Next, we'll go to Kathleen Jones from Nova Scotia.
Hi there, Dr. Strang. So I'm wondering, I understand that the Airport Authority submitted a proposal in January for testing at the airport, and I'm wondering what your thoughts are on implementing this proposal going forward, especially with airlines establishing more flights to the region.
Yeah, we're continuing to work with the airport. We've had conversations with them about starting to do testing based on them as a workplace. I missed a call getting prepared for today. I missed a call of my testing team this morning. So we've agreed that we're going to start building capacity around testing and work out the logistics at the airport based on testing employees, and then we could move that to start to do travelers, if that makes sense. Having said that, we already are testing all the temporary foreign workers are coming in. We're testing them right at the airport with rapid testing, and then they're going off to their quarantine site, and they have a series of testing while they're being quarantined as well.
Are there any thoughts at the moment on whether introducing this testing for travelers could reduce quarantine periods eventually?
So the science is not really clear on that yet, and until myself and other public health folks would say, until we get much better science, that it would be very risky to start to reduce the quarantine, especially for people who are unimmunized. And just based on testing results. We've had a number of circumstances, and I know my other Atlantic provinces, I talked to my chief medical officers, we've all had cases of travelers who have tested negative on entry, tested negative maybe around day 8, and maybe at day 12. Then they test positive at day 12. So there's still value on holding that 14-day quarantine and doing that late test.
Next, we'll go to Jennifer Henderson from the Halifax Examiner. Go ahead, Jennifer.
Good morning, Dr. Strang, Premier. I guess my first question is for Dr. Strang. We saw 9 cases since Good Friday in the Western Zone, and they're all related to international travel. Can you confirm that these were temporary foreign workers coming to work here in Nova Scotia?
We've had a number of cases in groups of, we've had charters of temporary foreign workers, and we've had a number of cases that have been positive, but it shows out the value of what we're doing actually works. We test them right at entry, they put them into a quarantine, and then we test them 2 more times. And we've already, if they test positive at entry, they go to a separate quarantine facility. And and they don't go with the rest of their workers, and all of the temporary foreign workers are now in single room occupancy in terms of their quarantine site, the hotels or the Cornwallis Convention Center. All of those measures are to decrease the spread, but we need temporary foreign workers. They're critical and essential to our agriculture and our seafood processing. So we have to come in. The fact we're seeing what we're seeing, to me, is confirmation of we have the right protocols and steps in place to protect Nova Scotia for the first 2 weeks while they're here, while we allow these essential workers to come into the province.
Just to follow up, it's probably early in the season to ask this question, but I know I'm seeing letters to the editor, and seasonal residents, people who have property in Nova Scotia who come here from the United States, have you given any thought or consideration to allowing those people to come if they can provide proof of vaccination and a clean COVID test and agree to the 14-day quarantine?
So first of all, if they're coming internationally, they're under federal jurisdiction, and they'd have to adhere to federal rules around 2 weeks of quarantine and testing before they leave, testing upon arrival, a quarantine site for 3 days till that test result is, then they can travel on and then have a subsequent test. There's lots of discussion right now that I'm involved in public health nationally about how do we start to potentially, the evolving evidence around people who are vaccinated, and can we start to be less restrictive with those individuals? There's lots of evolving evidence, as I've said before in a previous question, that we need to do this carefully. That we don't want to take undue risks, whether it's people coming from other parts of the province, or sorry, other parts of the country into Nova Scotia, or people coming from other countries into Canada. We have to make sure that we're doing things, yes, there's good evidence to support being less restrictive, we can, but we also have to be very careful about what types of risk we take, especially with the evolving situation around variants.
Next, we'll go to the phone lines. Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, I know you touched on the Pfizer and Moderna vaccine. Today is the first day people who are 55 to 64 can book an appointment for AstraZeneca. It looked like a lot of locations were fully booked this morning. Can you talk about the uptake for that vaccine so far?
Yeah, we know there was a number of people booking very early this morning when they became open. There's lots of appointments there. We have 38,800 appointments that people can book. So there's lots of access to that 55 to 64 to book their AstraZeneca vaccination.
Go ahead, Natasha, with your follow-up.
Thank you. Premier, I just wanted to check. So starting tomorrow, the border to Newfoundland is open without having to isolate. Is the plan still to open the Atlantic bubble on the 19th? I know you talked about watching New Brunswick really carefully with their outbreak in the Edmonton area. So what's the latest for people who are watching today?
Yeah, as of today, that's the plan, but as you know, day to day, things change quickly. So that's the benefit of our plan that's worked so far, is being nimble enough to make changes on a day-to-day basis. We're watching the cases in our neighboring provinces very closely. We'll continue to do that. But this gives a benefit to people coming here from Newfoundland, where there's a handful of cases. Our resources up there in that border region can be redeployed, so there's a number of reasons why we wanted to act once we had the advice from Public Health.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Yeah, Dr. Strang, I just want to revisit, just to be clear, on the rotational workers, and you're reassessing it, but currently, is it because of the situation with higher rates of infection in other provinces where they're working? Is that what made you hesitant in the first place in terms of loosening the restriction rules?
Yeah, I mean, we certainly recognize the importance of rotational workers and the imposition all throughout the pandemic that they've had to follow, but also recognizing is that because of their regular travel back and forth, there's some substantive risk for bringing COVID into this province, something that we're very careful to protect against. And with the variants, that becomes even more of a concern. So we're looking at what other provinces, our Atlantic neighbors, are doing, and seeing, as I said, the evolving evidence around the benefits of vaccination. But also we need to, so there's some very practical considerations. So even if we did give them some modified protocols if they've been vaccinated, we'd have to set up a mechanism that they can actually demonstrate proof of being vaccinated. That may sound easy, but there's a number of things we'd have to work through to do that on an online basis as part of our safe check-in. So I've asked folks to start looking at what's practical in that piece as well. So there's a number of, there's a decision to be made, but there's also some operational aspects that you have to work through before you can implement any decision.
Go ahead, Keith, with your follow-up.
And along the line of the variant strains, apparently there's been evidence emerging of a new strain, I think out of Tokyo, that may be resistant to all of the vaccines. Do you know anything about that, and how much of a concern is that for health officials everywhere in general?
I just saw the news report on that. I'm sure we'll hear more about that from the Public Health Agency of Canada over time. Anything like that, of course, would be concerning. An early report that may or may not turn out to be true, but we know internationally, and this is a key role the Public Health Agency of Canada does. They are a part of a network watching the evolution of these variants of concerns internationally, and that is then all the provinces and territories are regularly updated through the tables that I sit at with the other chief medical officers of health.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This is for Dr. Strang, and just getting back to the AstraZeneca vaccine appointments. Only about, unless I was misunderstanding the booking information that was associated on the booking site. And full disclosure, I was one of the people trying to get an appointment in the central zone. Only about a quarter of the locations covered the 55 to 59 range. Most were in the older range. Will there always be a limited number of locations covering all age ranges, or did I misunderstand the information that was associated with the booking locations?
Yeah, so we've identified pharmacies and physician offices specifically to deliver AstraZeneca, so we have a smaller number of those. Other pharmacies and doctors' offices are delivering the Pfizer and the Moderna for community clinics. So we've got two separate groups that are delivering the different types of vaccine.
Go ahead, John, with your follow-up.
Okay, maybe I didn't make the question clear. I realized that. I was looking, particularly for AstraZeneca appointments, and I was looking at the locations, and some locations just said 70 and older, and not the 55 to 59 range. Maybe I'm just confused about the way the information was laid out there. It seemed like they weren't covering the whole age range.
Because I mean, if a clinic is offering 70 and above, then they're using a Pfizer or Moderna product. If they're offering 55 to 64, they're using an AstraZeneca product.
Next, we'll go to Andrea Blanc from Radio-Canada. Go ahead, Andrea.
Hello, Premier Rankin. What if one of the New Brunswick regions is still in red on April 19? Are you ready to delay the reopening of the bubble?
So that'll depend with what public health deems is the risk level. Generally, if they're in the yellow zone, that gives us comfort. Right now, the only red zone is in the northern region, and we don't see a lot of travel from that region into our province, little to no travel. So that's what gives us concern if there's travel coming in from a red region. So that would give me pause, yes, if there was a red zone near our border.
Andrea, go ahead with your follow-up.
So if I understand well, would you be open to reopen the bubble, even if there was a red zone, but just assessing the situation to make sure nobody comes from the red zone? Is that right?
Well, that's status quo, what you're describing, because right now they do have that red zone in the northwestern region. They're doing well, but we have to watch it closely. As you know, there's no 14-day isolation period now. So that would not change unless their epidemiology changes, and I have a different recommendation from Dr. Strang.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. This question is for Dr. Strang. If you could just talk a little more about contact tracing. In the question someone asked you, you said, well, maybe within that first 48 hours if they hadn't been identified as a close contact. Is that usually how long the contact tracing takes to identify someone as a close contact and to get it all done? Is it about 48 hours?
No, I'm not using that. We often go people if they're identified as symptomatic. Well, often you take them they're infectious in the 48 hours before they became symptomatic, or if they've been exposed, then they may. So it depends on each individual case and when they might have been considered infectious. I just use 48 hours as an example. The point is that there are people that could be infectious and out in communities, not breaking a quarantine, and that we weren't aware of them. And those are one of the circumstances of when we would use a public notification.
Go ahead, Victoria, with your follow-up.
Thanks. And this next question, Dr. Strang, is related to something from a technical briefing a couple of weeks ago. You mentioned that if the vaccine became more of an annual thing, that we would have, a more developed process for it, like the flu vaccine every year. Is the COVID vaccine likely to become an annual thing or more frequent than just the 1 or 2 shots that people are currently planning to get?
So that's an unanswered question. Internationally, across the world, people are looking at that. The immunologists, virologists, we're not sure yet. Is there going to be, but there's certainly the potential that there'll need to be periodic booster doses or adjustments of the vaccine based on the development of new variant strains. Part of it is we really don't know the long-term nature of this virus. And so there's a lot of unanswered questions about that, and there's certainly lots of discussion about maybe it becomes like a flu vaccine, or we add it to a flu vaccine and people get it maybe every year, or whatever, on a periodic basis. But a lot of science has to be gotten through a lot of research before we can definitively answer those questions.
Next, we'll go to Ed Halverson from QCCR Radio. Go ahead, Ed.
Yes, thank you. I see you've got the opening of the retail and some of the service sector open. I'm wondering what would have to happen to expect the restrictions to be eased on the majority of the service sector, things like restaurants and pubs.
So they're allowed. Last time we increased their hours. They're still physical. They still have to be physical distancing, groups of 10. I think we still have to be very cautious when it comes to the number of people that can get together in groups, whether it's in their home, at a restaurant, the need for physical distancing, whether it's at restaurants or other types of gatherings, the number of, we still have up to 100 indoors, 150 outdoors. Those are all the things that, quite frankly, have helped us minimize the spread. We've had variants in Nova Scotia that haven't spread like other provinces. And I have to ask myself, why? Is it just because we're lucky? I don't think so. I think it's also because we have adhered to, even with very safe epidemiology, we are still hanging on to these public health protocols, the restrictions, and Nova Scotians are following them. That is certainly premature to relax on those in any substantive way in April, while the variant is all around us and outside of Atlantic Canada. Maybe as we get into the summer, and then we can start to see, does this variant wave start to decrease? What is the impact of, as we get high levels of vaccination by the time we get into June? Then maybe we're in a different space, but certainly for the next a couple of months, I'm very nervous about the next couple of months, and we're not going to relax something beyond where we're consider it safe to do that while we look at how the variant is playing around in other parts of Canada. We need to stay cautious. We need all Nova Scotians to follow the protocols while we get through April and May, and as we build high levels of immunity through vaccination.
Go ahead, Ed, with your last question.
Thank you. You actually answered my question.
Perfect. Thank you. And that's all the time we have for questions. Go ahead, Premier.
Thank you. We continue to hear great stories from people about how easy it was to book their appointments online and how well organized and efficient the clinics are. As Dr. Strang noted, we're continuing to make improvements to make it easier for people to book appointments. As we get more vaccine, there will be more appointments available and more locations. I know that the staff and volunteers working on the front line very much appreciate the feedback. They are focused on making sure that Nova Scotia's clinics are providing a quality, safe, and efficient service, and they are doing a great job. A common theme they are hearing is how thankful people are to get the vaccine and how ready they are to start looking forward. We are too. And that's what this vaccine represents, our way forward through the pandemic. Thank you very much.